So my name is Cathy Pearl. I'm Director of User Experience at Sensely. Sensely is a startup here in San Francisco, and we have our virtual assistant is a nurse named Molly or Holly or Olivia, depending on where you live, because we found people really seem to care about what their avatar is named. And we're focused mainly in the healthcare space, helping patients with chronic health conditions.
Can you say anything more about that?
My background, let's see. So I've been in the speech business since 1999. I started out with doing IVRs, the ones, as Tim Tuttle mentioned, everybody hated. So that was a fun career for a while, and just doing other stuff in the voice space. And my background's in cognitive science and computer science.
So my name is Thyme-Gobbel. My background is also many years at Nuance with Cathy. So this is a very contentious panel, you can tell. Before that, I was doing more speech-related, language-related R&D with emotion detection and automatic language identification, things like that. And then I left Nuance and I went to Amazon for a little bit and worked on the Echo and the phone. And then I got recruited to my current company, which is called 22 Otters. And we are also obviously in the health virtual assistant space. We started out by focusing on the acute side. And the very first thing we did was a colonoscopy app, which, if you know anything about colonoscopy, you know that's a fun time. And if you don't, you have something to look forward to. The thing about colonoscopy is that the preparation, so it's usually, in this country at least, it's different in other countries. Here, when you hit 50, the doctor tends to say, okay, it's time for one. But there's a lot of preparation, including you have to change how you eat. Don't eat any nuts a certain number of days before, things like that. And people are just, freaked out, right? And they don't want to do it, and they kind of mess up the instructions, and then they show up to the appointment, and they may not be prepared, and they might be sent home, and they have to come back later. And so obviously there's this thing about losing, money and time and so on. So that was the first thing, and now we're also in the chronic space. But our assistant, we basically have a platform that allows us to create very quickly, based on the clinician's instructions, a virtual assistant that has the same content but presented in a multimodal fashion. So we have speech out, and we have Q&A that a person can ask in their own words, questions about the procedure and so on.
Thank you for that introduction. I can tell you're both bringing a really fascinating perspective to this space. And I guess just to start, as I said, the potential seems staggering. What kind of changes do you think that widespread use of virtual assistants in healthcare could bring? And how soon might we start to see some of these shifts?
So I guess I'll start. So I would say, to answer the second part, we're already doing it. So we have, for example, some patients in a chronic heart failure program, and they use it on a daily basis. Every day they use our avatar. They talk to her. She asks them to take their weight with a Bluetooth-enabled scale, blood pressure cuff, ask a few questions. This information is then transmitted back to their clinician. And if there's an alarm, like they gained weight very rapidly, which is a bad sign when you have chronic heart failure, the clinicians are alerted right away, and they know that particular patient needs a phone call or an intervention. And I think the real way that this is going to revolutionize healthcare is that research has shown that people who get more attentive care, especially when they have chronic conditions, have better health outcomes. We do not have enough nurses and doctors to call someone every day or visit them every day. And Sensely is not interested in replacing doctors and nurses. We are interested in making tools to assist them and making patients' outcomes better. So if they can interact with a virtual assistant, it gets them to do these things that are important for their medical lives that a doctor and a nurse, they just don't have time to do. And that's going to be a great fit, I think, to fill this gap that we have in the medical field.
I totally agree with what she said. The other thing also that we find is around engagement is we can actually tell based on how much people are engaging with the app, we can predict how likely they are to be a no-show for their actual appointment, which is obviously something that's of interest to the providers. But yes, to be able to actually engage the user, to allow them to take some amount of responsibility and ability to actually answer their questions easily and whenever they have them. And we also do not try to take the place of the doctor. Instead, we are very clear that, the content is all based on the clinician's stuff. They have to sign off on it. And it's also helpful for the user to know that, hey, this is something that my doctor's actually saying. This is good stuff. So.
What are some of the roadblocks that we might hit as this technology becomes more mainstream, both technical hurdles and otherwise?
I would say a lot of the hurdles we've run into are not so much about our avatar or the users being able to talk to the avatar. That's actually gone pretty smoothly. Our problems are more around, because we're in the medical industry, and let's say you want to work with a hospital or a clinic and they're very interested in your product, but the process to get it approved and in the hands of the patients is very slow, even if they're eager to do it. And even if they approve it, then it's like getting that set of patients. For example, with chronic heart failure, these patients are generally older. A lot of them don't have smartphones. It may be harder to build up the number of patients you need in order to make the program effective. Another technological issue that's, again, not around the avatar or our technology, but around integration with medical devices. We integrate with Bluetooth devices, which, if any of you have tried to pair your phone with your car or other Bluetooth things, it can be very frustrating. And imagine you're 82 years old, and I was talking to a patient last week, and he got a new phone, and his app didn't work anymore. And I had to walk him through over the phone, this is how you pair your Bluetooth blood pressure cuff and things like that. So there's going to be a little bit more of a learning curve for some of those patients. But one thing I want to emphasize is don't give up on those patients. A lot of people might say, oh, they're too old. They can't use the smartphone. They can't use the blood pressure cuff. No, they might need a little bit more time to get comfortable with the technology, but they will do it, and we should not just dismiss that patient population because it can be very successful for them.
This is a real key thing, what you just said. We both really find that this is something we would like to get across to everybody, right? Especially, it's the basic thing of know your user and build what you're building for the actual population you're trying to reach, right? So, like I said, with colonoscopy stuff, right, since that's something that it's mainly older users, we immediately have this thing of, well, what should the app look like, right? And of course we have, it is multimodal, but it's very important to have text that's not like skinny gray font, right? But to have something that people can read and talk at a level with using words that are appropriate for whoever the audience is. Because also, if you're stressed out because you're sick or because you haven't eaten for a day, you're not going to relate to the material very well. So you want to make sure that you're actually speaking to the user in a way that they can comprehend. But yeah, don't give up on older users, because older users that's you in the future. And older users are very smart and very much willing to help you if you're willing to listen to them.
Yeah.
Health crises can be, some of the most vulnerable experiences in an individual's life, and I'm curious to know how virtual assistants can gain the necessary level of trust to be able to help people through these experiences.
I think it's a really good question, and we're finding that already our patients are building trust in our avatar. They tell Molly very personal things. They might tell her that they're stressed out because their mom is in the hospital, or I'm worried about a procedure. They also tell her, I was thinking about the presentation yesterday with Dennis talking about the messaging, the scheduling app, and people saying, thank you, Amy, and all this stuff. Our patients do the same thing. When they miss their check-in, they apologize to her. They say, oh, I'm sorry, Molly, I missed my check-in this weekend, or have a nice weekend, or it's time to go to church, or, they tell her all kinds of things. And the reason that I'm excited about that, it's kind of neat, but the reason I'm excited is because to me that means engagement. They're engaged with her, they trust her, and this trust and engagement means better compliance. Better compliance means better health outcomes.
Yeah, and to actually have something where the doctor says, or their medical provider says, this is something that I think is a good thing, use this, that in itself builds trust right away, right? But like what Cathy was saying, the kinds of quotes that we get from the users is great. It's like to actually hear this directly from people and just in post interviews and things like that too, not just automatically in the virtual assistant, but some of the quotes that I pulled out, some things like, it's like having a little procedure buddy. It reduced my anxiety level. It feels like a bit of human contact, things like that. Or one of my favorites here is I was just at Safeway stocking up on clear juices because you have to drink clear juices for colonoscopy. I thought briefly about how vodka is clear and would go well with the prep, but sadly the app said I was not advised. So I just imagine her standing there in front of the liquor section and asking the question, is it okay to drink vodka today? And the app saying, no, you can't do that.
Yeah, and to add on to that, in patient interviews after the fact, I always ask my patients, It takes a little while to do your daily check-in when you talk to Molly and she guides you through the whole thing. Would you rather just have an app in front of you where you could just push buttons? It would do the same stuff. It would take your blood pressure, it would take your weight, but it'd be faster. And they all say no. That would be boring. I don't want to do that. And just think these people are asked to do this, for 90 days, every day, over and over. It's boring. Nobody wants to do this. But they're doing it. In fact, they're only required to do it for 90 days. After the 90 days have ended, our patients keep going. They don't have to, but they voluntarily are doing this. One patient told me, it feels like someone is holding my hand. It feels like somebody is watching over me. They know it's a virtual assistant. We're not fooling them, but they still find it very comforting.
That's wonderful. These applications, of course, can take many forms. I've been dabbling with Lark, a messaging app that monitors activity level and diet. I'm curious to know what role you think avatars in particular have to play.
Sure. So the avatar for us is kind of at the forefront of what we do. We have an avatar. We use text-to-speech as our output. And there's been research at USC that shows that when people are asked a bunch of questions, if it's an avatar versus a still picture or like a list of questions, they're willing to answer more questions when they talk to an avatar. They're also often willing to be a little more personal or honest with an avatar. So that's kind of the foundation of what we're doing. And one thing I find interesting is that the avatar doesn't necessarily have to be extremely complex to build trust and engagement. People will still engage with an avatar that's not like super intelligent. They'll still want to engage.
I think the moving avatar is a really interesting space for those exact reasons. We haven't used that so much so far. We have different photographic images when we do need a nurse, but then we don't use TTS. We actually have recorded speech to go with it, and people are still very happy with that. I think one thing I would be concerned about with avatars is just what do we do when there's no connection or something, if it's actually something that is running in the cloud. And also, if you have an avatar, I think it's important to have some amount of choice, right? Because it's kind of more of a bimodal thing, right? Where some people might love it, some people might hate it, just like in our old IVR days, right? If you do a set of voice prompts for the IVR and have a talent who is very, peculiar in some way, very like strong persona, some people are really gonna love it and some people are gonna hate it, right? If you go more vanilla, then more people will put up with it, but they may need to love or hate it, right? So I think something of that has probably come up with avatars too, right? That you might want to have some level of choice, right? It's like I want male or female or whatever.
Yeah, it's always a fine line arriving at a design that works for everyone. Yeah. One question, of course, that's always top of mind in artificial intelligence is what this means for humans. And I'm curious to know how you envision these virtual assistants working with healthcare professionals.
Yeah, for us, it's part of our key model, which is this is a team. So we've got the patient at home doing their remote monitoring, and it allows the clinician to not have to call all 500 of their patients or only see them every so many months to see how they're doing. Now the clinician can be more focused because the system, the virtual assistant, is telling them, these are the patients who are having trouble right now. This is where you need to make your interventions, and those patients are going to benefit. So we see it very much as a team effort. And one other thing I've been thinking about recently is I was doing some research on people with Parkinson's, and I was speaking to some people who were the caregivers, often the spouses of someone with Parkinson's. And originally we were thinking, what can we do with this app? Oh, it can be like a whole wealth of medical knowledge about how to manage Parkinson's. But I really realized after talking to these caregivers that their most frustrating moments were around a lot of interactions with their spouse where they had to be the bad guy and keep telling them, take your pills, do this. Or they would get frustrated because the person with Parkinson's might have memory issues and be telling the same story over and over again, asking the same question. And I'm thinking, if the virtual assistant can offload that thing, virtual assistant doesn't care if they tell you 10 times to take your pills because they don't care if you get mad at them. You can ask the virtual assistant that question 10 times. Offload that to the virtual assistant. What's going to happen to the caregiver? They're going to have more energy. They're not going to be so fed up with the daily maintenance that they're going to be able to sit down and have a real human-to-human connection with their spouse or whatever because they're not fatigued by these other things. So I'm saying let the virtual assistant do some of that other work. Let the human get to have that human-to-human connection.
Mm-hmm. Yeah, I think more freedom both for the patient, or the end user, or whatever, and the caregiver, both. That's key. This reminded me actually of something else that I heard in a post-interview, where the woman who was using this for colonoscopy again was actually saying that, oh, this made it a lot easier, instead of like reading through this, multi-page small print thing, right, and try to find the answer, but to actually sit there with the app with my spouse and go through it together. That it was easier to sort of show what was going to happen. It was kind of this joint effort. It wasn't just me going off in the corner and doing this by myself, but actually it was kind of like bringing together, people and not being, and again, like not being like, I'm not making this up. Look, she's saying it. So.
Right. Yeah. I'm sure it won't be long before we hear stories of virtual assistants saving marriages and all this. And I'm curious to know, sort of what role does NLP play in all this as you try to build assistants that can connect deeply with their users?
I was reading an interesting article the other day in Wired by Clive Thompson where he was talking about a lot of what we think about making a conversational assistant. We think it has to have so much knowledge, so much deep learning in order to actually have a real intelligent conversation. But he was looking at the version of Cortana in China, I forget what it's called, it's text-based. And those have very long turn-taking things. People are, on average, talking like 23 back and forth, which for a chatbot is a very long time. And he thinks the key there was actually there was a lot more chit-chat. When you go into a restaurant and you sit down, you don't just say, I want this food. The waiter says, how are you doing today? And you have a little back and forth. You establish something. So these chatbots have these more chit-chatty kind of personalities, and that's not like super NLP or super intelligence. It does require some, of course. But you can get a long way with some of these basic models. I don't think we should just throw up our hands and say it's too hard, we're not there yet. We can still build a lot of engagement with the tools we have now.
Mm-hmm. Totally. I think if you want to actually... If you want to understand what somebody needs, you obviously need to understand what they're asking for. And so it's a question of having the content base and the ability to actually understand, take what this kind of scattered sentences that they come up with, right, which is not going to be Wall Street Journal quality, right, if they're asking a question, and understand what's underneath it. And, we do make a lot of use of speech and parsing in various ways in our apps. Like I mentioned, you can do something like just ask a question. Is it still okay to eat peanut butter? Right, and you're going to have a different answer one day versus another. Maybe you can also say, well, can I eat peanut butter tomorrow? And better understand that you're talking about tomorrow and not today, right? And so those are just kind of simple questions. And so we have also a whole, ontology structure around the kinds of foods people might ask about and things like that. So there's a lot of back and forth like that, and really it comes down to really understanding, trying to get a sense of what is this person really asking for, or if it's a question of how are you doing today, which is something we both do also. Right? What are they actually saying when they say my feet hurt, or whatever.
I'm really fascinated by how personality plays into all this, and I spoke with the creator of one medical avatar who has the avatar actually speak in a British accent to American users, sort of finding that people are less critical of a virtual assistant that doesn't speak like they do. And I'm just curious to know in your in your early experiences with patients if there have been any qualities that people seem to prefer in their virtual assistant.
It's interesting. We have a British version of ours, but that's in Britain, so we haven't tried the British in America. I think the qualities, the consistency was one thing that we talked about yesterday in terms of putting trust in personality, so we make sure our avatar is very consistent. She doesn't do strange, surprising things. Otherwise, I think it's important to have empathy, and also you have to be careful with the empathy. But I noticed, for example, we had a patient, after they weigh themselves, if they haven't gained weight, the avatar says, nice job. And I was talking to the spouse, and the spouse was like, oh, it says this silly thing, nice job. But she said, but my husband really likes it. So, you don't want to cross over to the line where you sound patronizing or fake, but at the same time, don't shy away from it completely. We used to have IVR customers who say, you can't say I'm sorry. Right. It's a computer. The computer's not sorry. But it's a discourse marker. Right. It's how we communicate. That's the model we're used to. So you have to find the right balance, but it's important to have that be part of the personality.
Yeah. We have one, like I mentioned, we have one voice and one photo, although the photo is the same person, different angles and things like that. But since we're not using TTS, we have more control, obviously, about the emotional delivery of the voice, right? So she's very good about actually delivering something that's, not over the top, but, really conveys concern when appropriate, or, great job, and that's appropriate. And so far, all the feedback has been, oh yeah, we really like this, and she's really nice. When she wakes me up in the middle of the night, she's very polite about it. So.